When it comes to giving birth, there are a few main ways a woman can deliver her baby. The safest option depends on the specific circumstances of the mother and baby, and a doctor's guidance is always the best resource. There are two primary ways to give birth. Vaginal delivery. This is the most common and natural way to give birth. It involves the baby passing through the birth canal. It can happen with or without medication to manage pain. Cesarean section, C-section. This is a surgical procedure where the baby is delivered through an incision in the mother's abdomen and uterus. It is performed when a vaginal delivery would be too risky for the mother or the baby. For most women, vaginal delivery is considered the safest option with the lowest risk of complications. It typically involves a shorter hospital stay and a faster recovery for the mother. However, a C-section is the safest choice in specific situations. A doctor will recommend a C-section when there are clear medical reasons, such as the baby is in a difficult position, like sideways. The baby's heart rate is a concern, indicating they are in distress. The mother has a health condition that makes vaginal delivery unsafe. The most important thing for a woman to know is that the safest way to give birth is the one that is best for her unique situation and her baby's health, as determined by her healthcare team. From a medical perspective, the best age for a woman to have a baby is generally considered to be in her 20s to early 30s. This is because women in this age range typically have the lowest risk of pregnancy complications, and the chances of fertility issues are lower. However, many women have healthy pregnancies and babies well into their late 30s and early 40s. The decision of when to start a family is a deeply personal one. A woman's readiness involves much more than just her age. It includes her emotional, financial, and life situation. What truly matters is a woman's overall health and the support she has from her healthcare provider. A cesarean section or C-section is a major surgical procedure. While it is often a life-saving intervention for both mother and baby, it does carry certain risks that are not associated with a typical vaginal delivery. The level of risk can depend on whether the C-section is planned or an emergency. A C-section is a major surgery, and as with any surgery, there are potential complications. Infection. This is one of the most common risks. Infections can occur at the incision site on the abdomen or in the uterus itself. Increased blood loss. A C-section typically involves more blood loss than a vaginal birth. In some cases, this can lead to anemia or may even require a blood transfusion. Blood clots. The risk of developing blood clots in the legs or pelvic organs, a condition called deep vein thrombosis or DVT, is higher with a C-section. If a blood clot travels to the lungs, it can be life-threatening. Injury to organs. Though rare, there is a small risk that nearby organs, such as the bladder or bowel, could be accidentally injured during the surgery. Longer recovery time. The recovery period after